Okay, welcome everybody. I am very excited to have a very special guest today, Ryan Obermeier from Evexia Diagnostics. And Ryan and I have kind of crossed paths. I feel like we kind of hang out with the same group of people and have been collaborating over the last few months. And Ryan, you have had such an amazing background, not only at Evexia Diagnostics, but Forum Health and Orthomolecular. And I like to tell people you're probably one of the most well-connected people that I've ever met in the space, not only with your network, but just your vast amount of experience. And so it was interesting in getting to know Ryan and the topic of cash-based labs. And obviously, labs are a big part of our clients, day to day. Getting patients in the door and diagnosing them and treating them. And I do feel like so many of them fall into this, like they feel like it has to be covered by insurance. And when you had brought up this whole cash-based labs concept, I was like, yes, we absolutely have to get Ryan on to talk a little bit more about this. So I have a few questions for you, Ryan, and we'll kind of start there, and then we can kind of see where the conversation goes, if that's okay with you.
That sounds great. I am super excited to have this conversation. As I mentioned when we first set this up, I think this is the most important conversation to have regarding this service line. And again, the service line we're talking about is lab testing in an integrative functional medicine or a cash-based practice.
Yep, yep. All right. So, couple questions that I have prepared for you here first. So, with regard to laboratory testing, what do you see the greatest challenges that physicians are facing in this integrative and functional medicine space?
I think it's today's conversation. It's honestly monetizing. One, this is through the lens of labs, but really it's monetizing everything in the practice. And with labs, there's a lot of what I call hidden costs, right? It's ordering the lab test kits, it's receiving the lab test kits, putting them on the shelf, placing the order for the lab when the lab results come in and doing the interpretation. And that's a lot of hidden costs. And most healthcare professionals don't really recognize that. In the business world, we call that time and motion. So you can simply take the time and how much you charge for your time. Maybe it's $500 an hour. And how much does it cost to place the order, receive the boxes, getting the supplies on the shelf, doing the interpretation? There's value to that. And I think too many providers don't recognize the hidden costs. And I would also say that a lot of healthcare professionals have a big heart. And with a big heart, they try to do the best by their patients. I love that. And that's what I love about this industry. But there's a balancing act of understanding that, yeah, my time is money, and are hidden costs associated with adding labs to my practice. Many people don't recognize this, but it is a heavy lift to add lab testing to any practice, and especially a cash-based practice. So number one is, I would just simply say, biggest challenge is monetizing everything you do in the practice. But in this conversation, obviously, it's monetizing labs.
Yeah. And I think a lot of doctors, because you're right, they care so much about their patients and they're mindful of the expense because a lot of this is, maybe the program that they offer is cash based and they feel like, I don't want to nickel and dime the patient,
Yes.
let's just go through the insurance. Like they feel like they're doing them a favor by going through the insurance route. So what is your thought on this whole, like, I don't know. I feel like a lot of them are just very hesitant to offer cash based labs because they don't want to nickel and dime the patient.
I hear that a lot. And so what you'll typically see is bundling or creating programs so they don't have to show, hey, I'm charging you for the labs or I'm making money on the labs. But that's what I mentioned earlier. That's what I love about this space is our providers have big hearts and they want to do the best for their patient. There's two challenges that I see with that is because for the most part they're functioning in the cash model, they have not taken the time to become fluent in insurance, the insurance model. Do you understand the nomenclature? What's the difference between copay versus co-insurance? What's a premium? What's a deductible? What's a high deductible healthcare plan? And although most providers, their intent is to deliver as much healthcare at a reasonable cost as possible, they don't recognize the downside of trying to funnel labs through the insurance model. And what we're going to talk about today are 8 arguments or 8 ideas that you're going to want to hold in the back of your pocket to become fluent. And I think everybody in the audience understands is when I understand something as a provider, I'm more confident when I communicate. And when I'm more confident when I communicate, I can direct patients to the best decision for them. Where if I don't take the time to become fluent, yeah, I'm just going to rely on, yeah, we'll run the labs through insurance. Not really understanding that in 7 out of 10 times, or so let's say 7 out of 10 patients walking through your door, insurance is probably not the best decision for them.
Interesting. Yeah. I'm really excited to hear these tips. So one real quick question before we get in, because I know you've got a nice little kind of show and tell presentation for us, which I think will really explain some of these tips more thoroughly. Any suggestions that you have, and maybe you're going to touch on this on your presentation, ways to maximize the diagnostic lab service line for the individual practices patients?
So the way that I would maximize lab testing is kind of what we've mentioned earlier is I would want to monetize everything. I would want to know how much am I charging for my time? What are all those hidden costs associated with it? As I mentioned earlier, I didn't dive into it too much, but if you still have a little bit of heartburn associated with charging, or you'd mentioned the nickel and diming, I hear that term frequently. I don't want to feel like I'm nickel and diming everybody, then probably bundling or creating programs is a great way to do that. I would say over my career, I had bought 40 medical practices in a very short period of time, and we knew exactly how much money each provider needed to generate just to keep the practice afloat, to maintain the viability of the practice. And so going back to the concept, I would have a clear understanding of what time and motion is. How much does it cost to actually offer labs in the practice? And then make sure you charge for that. And bundling would be a great way to relieve any heartburn that you might have by still running labs through a cash-based model.
Yeah. Okay. Well, let's dive into it if you don't mind, Ryan, and kind of diving into your presentation.
Can you see my screen?
Yep. Looks great.
Okay. So this is a presentation, but it's certainly, I would encourage you, Lori, to jump in if you have any questions. I've been in the integrative functional medicine space. This is my 27th year, but I've only been in lab testing for 2 years. So it takes a little while to kind of figure out, all right, what are the challenges in this particular space of the integrative functional medicine industry? And so what I did is I kind of really thought about what are the challenges. And so that's the magic 8 ball. So I have 8 arguments on why, if I was a healthcare professional, I would probably steer 7 out of my 10 patients towards a cash lab versus trying to leverage my patient's healthcare plan benefits. Okay. And so going back to what I said before is I need to be fluent. And when I have fluency, I I can persuade and I have leadership and I'm confident in the way that I communicate versus not taking the time to do so. I'm going to be like any human. I'm going to fall back on bad habits. And what we'll see here, with the very few exceptions, roughly 7 out of 10 patients who come through your practice are probably better suited for cash labs as opposed to really trying to leverage healthcare plan benefits of your patients. Does that make sense?
Yeah. Yeah. No, I think about my own experience with my functional medicine doctor. And I'll tell you, when she did run it through my labs or through my insurance, the bill was wrong. Then I had to call my insurance. And it was like, I was more irritated probably through trying to get my bill correct than if it just would have been bundled into part of my program. And so I can kind of see this just on my own experience. So yeah, let's go.
But the more people I get in front of this with this presentation, it's the same story.
Yeah.
Um, my partners, such as your organization, they're patients too. And I hear once we get to bullet point number 6, we're going to talk about back billing or balance billing. And I've heard so many horror stories where their balance billed like $3,000, where they literally could have been gone through cash and it would have been $200.
Yeah, my bill that I had to deal with Quest through my insurance that was misbilled and all that, it was like 9 months of back and
Oh
forth
yeah.
on hold with Quest. And it actually happened to both my husband and myself. It was over a $3,000 bill that I ended up fighting. But at the end of the day, like my time is valuable too. And I don't want to spend time on hold fighting with the lab company because they tried to go through insurance. So,
I agree with you
yeah.
100%. So let's just jump into these, and
All right.
please, Lori, jump in if you have any questions or any thoughts. But the first argument is really understanding what a high deductible healthcare plan is. High deductible healthcare plans means that there is a deductible that has to be met before insurance kicks in. So if we go through the nomenclature and what patients experiences, they're going to pay a monthly premium. And it is not unheard of these days to hear that that premium exceeds $1,000 a month.
I used
So
to have
just
a
to,
$6,000 deductible.
yeah. And today it's not unheard of to hear that deductible is now $10,000. And it's so serious. The IRS is now involved. The IRS has capped the deductible, which we'll see on the next screen, at $16,600. So with high deductibles, you have a monthly premium that you have to pay, and again, it's not unheard of to hear over $1,000 for the premium. But then when you start filing claims, the doctor visit, labs, prescription medication, you as a patient have to reach a certain threshold or a benchmark before insurance will even kick in. So you have to ask yourself, in the integrative functional medicine space, how likely is it for your patients to ever reach that deductible? And I would say, unless you're going to have a cardiothoracic procedure or if you're battling cancer, the likelihood of me as your patient even reaching that deductible consistently is probably not likely.
Yeah, good
So in
point.
a nutshell, guess what? It's out of pocket anyway. There, so even though you believe that you're helping your patient run stuff through insurance, it's not going to help out. So as I mentioned, as you had said, Lori, your deductible $6,000 to $8,000. I'm hearing more and more patients' deductibles are near above $10,000, and the IRS is involved. And I think for the most part, when we have today's conversation, we are talking in broad brushstrokes. So you're always going to find the exception to the rule and things like that. Again, we live in a very large country geographically with a population wise, so we have to consider where in the world are you. Number two, what insurance company are we discussing? And then the third thing, which we're talking about the high deductible healthcare plan, is what plan has been selected by the employer to be provided for their employee population. So benefits are a way to attract and retain patients, but let's be honest, employers are trying the cheapest way to do that. And high deductible healthcare plans is a way to do that. So again, bullet point number 1, what's the likelihood of your patient reaching that deductible consistently? And if they don't, guess what? It's out of pocket anyway. So you might as well charge them cash, which is going to be a much lower cost, which we'll see in bullet point number 2. That is talking about the cost of the labs. So the way labs are priced is in 4 ways: insured, uninsured, cash, and last but not least is Evexia, which I would believe that we undercut all of the pricing. So if we take a classic CBC, in general, again, we got to go back to region, insurance company, and insurance plan. I'm seeing lab companies are being reimbursed about $80 to $90 for a CBC. So CBC, as we all know, the most basic test you can run in blood chemistry. And that same test that is $80 or $90 through insurance is only $27 through cash. With Evexia Diagnostics, that test is $5.
Wow.
So what lab companies will do, and again, I liken it to the nut and the shell game, right? It's kind of like a play on words a little bit. These lab companies will come to you, the healthcare professional, and they'll say, doctor, I know that you love your patients and you're trying to do everything you possibly can for your patient. So if you just check this little box here saying that they're going to pay cash, we're going to extend a 90% discount to you for those tests. What they fail to tell you is they're actually giving you a 90% discount off of the insurance rates. So I'm sure everybody in this audience has heard someone who's gone to the hospital, maybe yourself, a family member, a friend, and you start reviewing the invoice and you're like, wait a minute, they charged me $13 for an acetaminophen pill. Well, you know, and I know that acetaminophen pills should not cost $13. So what's 90% off of $13? It's still a well overpriced acetaminophen pill.
Yeah.
So here's the example that you would see with CBCs. Look at that there. There was an example where there was reimbursement of over $7,300 for a CBC. Below that, you consistently see CBCs getting reimbursed for over $200. And as I mentioned, I more than likely hear between 80 and 90 for a CBC. Why this is going to be, this slide here and this discussion point number 2 becomes important is when we get to discussion point number 6, back billing or balance billing, these prices become very important because it's going to tell you how is your patient going to get balance billed or back billed. In fact, they're going to get back billed $13 for that acetaminophen pill, not 13 cents for that acetaminophen pill. So bullet point is really important, but it becomes more important when we get to bullet point number 6. Bullet point number 3 on why you might want to offer labs through cash or become equipped where you have the fluency to discuss this with patients. And again, fluency breeds confidence, and confidence allows you to steer your patient to the best decision for the patient. And as I mentioned before, most times it's not going to be the insurance route. So if you're not familiar with an HSA, a health savings account, this is a way that you can put away pre-tax dollars that will grow without tax and can be withdrawn without tax as well. In fact, it is a phenomenal investment vehicle for you and for your patients. But patients can use their HSA accounts to pay for lab testing. And not only can they use this to pay for conventional blood work, which you might suspect most of the patients are going to have, but look at this. It's also going to help them out with specialty testing. It even calls that out there in bullet point number 1. GI map from DSL, Genova Diagnostics would be the GI-FX stool test, and so on and so forth. So yes, your patients can use their HSA or FSA accounts to help pay for the tests, which we already know for the most part are not going to be covered by insurance anyway. That gives me a nice reminder that this discussion, a lot of times, is many people are just thinking about blood work, but testing in the integrative functional medicine space, it goes above and beyond blood work, such as salivary, stool, DNA, so on and so forth. Next bullet point is patients can always self-file. And this is where I put my feet into the shoes of a patient, because again, I'm a patient, I pay premiums, and I have a deductible as well, right? As we all do. And as patients, we want the insurance to kick in, even if it's like $30, like just pay something. I pay thousands of dollars. I've reached this deductible. Well, patients can always self-file, and that amount of money that they would pay cash will go towards the deductible. Here's one thing, though, I'm going to warn you or have you consider. If you are a provider who not only offers a cash area of your practice, but you're also contracted with insurance companies, if a patient has insurance with whom you're contracted with, I would certainly refrain from encouraging them from self-filing.
Okay.
More than likely, not guaranteed, it's probably against the agreement with the insurance company because they would view it as what we call pass-through billing, and pass-through billing you cannot do, and they'll probably come back for some money. So again, if I'm working with a patient who is Blue Cross Blue Shield and I'm contracted with Blue Cross Blue Shield, I would just not encourage my patients to go self-file.
Okay.
But if I'm not contracted with Blue Cross Blue Shield, encourage them to self-file. it's going to go towards that deductible. But again, the likelihood of most patients pursuing integrative functional medicine probably never, or at least not going to consistently hit that deductible year after year. And this just gives you some instructions on how to actually self-file. So it's really direct, pretty easy for patients to do so. The next argument is really understanding how privacy is important for some patients. Prior to COVID, privacy certainly was important for patients. I know this because we offer some DNA testing, and I can tell you our organization on a daily basis receives a phone call from a patient saying, are you going to destroy the results of my DNA, or are you going to be sharing this information? Privacy is really important for a lot of patients, but I think most people in your audience would certainly agree, since COVID, privacy has really become paramount for some patients. In fact, I just gave this presentation earlier today, and the person who hosted, they said, absolutely. If you run lab testing outside of the insurance model, guess what? That information is not going to be shared. So again, you might be working with some patients where privacy is really important, and maybe they don't want insurance companies to learn about some of those test results. By not running labs through insurance, obviously the insurance man is not going to learn about any diagnosis or anything that goes on there.
Yeah. I kind of like that from a marketing standpoint too, like, I mean, there's an angle, right, that you can leverage that, because I think you're absolutely right. I mean, the privacy is more and more important than it ever has been in the past, and people are worried about that sort of stuff getting out, or they're denied for future care for some reason because of something that showed up on a functional medicine report that they had done.
Yeah, there's a whole bunch of theories out there, and I think they're basically limitless on
Mhm.
what theories exist out there. But for patients where privacy is important, really cash is the way to go, right? Um, that gets us to bullet point number 6. So I kind of alluded to this before. It's this idea of back billing or balance billing. So what is back billing or balance billing? If a test that you as a healthcare professional in the integrative functional medicine space might order, that is not a negotiated test, or maybe the lab company is charging the insurance company above and beyond what the negotiated rate is, the patient is going to receive a bill, and the patient will be responsible to pay for that bill. So if you've been in the space for a little while, you might have ordered homocysteine in the past. So homocysteine has a unique history. Was covered by insurance, not covered by insurance, covered by insurance, not covered by insurance. And with a little bit of hyperbole, it probably was like week to week. So if I ordered on this week, not covered, and guess what? My patient's going to receive this huge bill. And as you mentioned, Lori, hearing thousands of dollars of bills is not unheard of. And in fact, you're probably the 5th or 6th person who's hosting an event like this that have said that they've been balanced. I've actually not heard less than $2,000 of balance billing. And in fact, I bought a medical practice in downtown Chicago, and we talked to the patient. Again, downtown Chicago, very affluent area of the world. Patient extremely affluent, but as most patients believe that they have the best insurance in the world and everything's covered and so on and so forth. So even though we helped educate him, guess what? He got a $2,000 balance bill, and the cash price was 200. So he could have just put $200 out on the table and been done with it. But no, later, months later, had to pay $2,000. So it's real important with the balance billing. This just gives you a clear example on when you don't meet the negotiated rate. So again, there's 2 scenarios of balance billing or back billing. Is one, a test is ordered, which is not uncommon of an integrative functional medicine provider to order that isn't negotiated in that agreement. But in the case that you see on the screen is when the amount was billed at a different amount. So it didn't actually reach the negotiated rate. So again, the patient then would be responsible for that. This reminds me, I was talking to another host of an event like this, and kind of like what you said, Lori, she goes, I not only was upset about paying that amount, I was actually upset with my provider that I had to go through this whole nonsense. So even though as a provider, this has nothing to do with you, what do they say? Sometimes perception is reality.
Yeah.
That is the reality that patients are going to blame anyone they
No,
possibly
I
can.
will say I did that because when I was going through the billing thing, it was kind of like the blame game. The provider's telling me it's Quest. Quest is telling me it's the provider, and I'm getting bounced back and forth. Now, of course, it ended up being the the insurance situation. It wasn't my provider, but you're right. Like somebody messed up somewhere, and now you're wasting your time going back and forth on hold and trying to get this whole thing sorted out. And like I said, for me, it was several months, and I had to go through it, and my husband had to go through it. So to me, it would have just been easier, like, hey, here's your 1 year functional medicine program. It includes your labs, it includes, and it's
Yes.
like I just don't have to worry about it.
Yeah. And I think what we're talking about is surprise. Here's a
Right.
huge bill. 6 or 12 months later, you don't even remember getting the labs done. I mean, it's
Well,
kind of
and I
crazy.
think like patients might leave the practice for that. Like
A
it,
hundred
like
percent,
if
without a
there's a
doubt.
pain in the butt that they have to go through and they know they need to get their labs done because right, the doctor's trying to optimize their levels or, get feedback on the protocol that the patient is now following, you're just like, if I'm going to have to go through this every single time, like this is not going to be worth it. I'm leaving or I'm going to go find another provider. So I think to your exact point, like being at least able to talk about, hey, 7 out of 10 patients, I may have a better way to suggest to them that's going to be a little bit easier and less expensive for everybody. I mean, I think that makes a lot of sense.
Yeah, I would agree. And, again, going back to the top of the presentation, this is broad brushstrokes. As providers, you're always going to come across the exception to the rule. But you've heard me and you just said it, Lori, and that's what sparked the idea is what I've uncovered in my time with Evexia is the patients who probably are best suited to go the insurance route would be those who have a PPO or those who have government insurance, which is Medicare, Medicaid, and TRICARE.
Okay.
Everybody else, for the most part, are going to be best suited through cash. And when you run the numbers, and I've done the Chat GPT thing, it's just under 7 out of 10 patients. And then, as what I also mentioned, costs continue to rise. Employers that are trying to attract employees, retain employees, are looking to add benefits to their offering, but they're also trying to do it as cheaply as possible. The way you can offer healthcare or health insurance is through high deductible healthcare plans. And that is certainly the trajectory. If you even type in a Chat GPT, like give me, what was it 10 years ago compared to today, the curve is straight up.
Yeah.
And so these are things and I know I've said this before, but I think it's important to just re-emphasize, even though your world is in the cash-based world, if you take just a little bit of time to become fluent, gain that confidence. So when these things come up in conversation with a patient, you can confidently communicate with them. Oh, patient, how frequently are you? One question, how frequently do you find yourselves having to pay for labs? And if they say, if I ever have to pay for labs, answer is you got to go with us because we can get you a 13-cent acetaminophen pill and not a $13 acetaminophen pill,
Right.
right?
Yep.
And again, it's just providers in this space have such big hearts. They want to do the best for the patient. They don't want to feel like they're nickel and diming. And the excuses or the reasoning just goes on and on and on. But again, if you just take a few minutes, become fluent, I think you're going to have better conversations with patients. And I think if patients knew how much you're going to do for them, I think it makes a lot of sense to we're going to provide you, Lori, with some assets that you can push out to anybody who might want them, kind of reviewing the concepts of today's presentation. Plus, we have some assets that the providers in the audience can share with their patients, both in digital, or excuse me, video and as hard copy as well.
And do you recommend, Ryan, like, is this something that the biller at the office also, like, because the provider can watch this and learn, but is the biller somebody that would be involved with like figuring all of that out as well?
I don't think it needs to go that way. So you might be
Okay.
talking about like maybe a hybrid model where some service lines are cash and some service lines are insurance and so on and so forth. I don't think it needs to go that far. I think it's
Okay.
just equip you with some questions that when you get the answers, you just know, hey, let's go. So again, PPOs are certainly going to be better served with the insurance plan because it's going to cost a fraction of what other insurance plans do and then the government insurance. But
Okay.
this would be really great if someone is running strictly an insurance, or excuse me, cash practice.
Got it. Okay.
In fact, I presented a little bit earlier today and they went through the whole scenario of, yeah. I mean, how many times do you hear, Lori, where they'll say, hey, I'm going to give you your panel. Why don't you go and schedule an appointment with your primary care provider and get these labs run through them? Again, your heart is in the right place. The result 7 out of 10 times is not going to be the best for the patient. So
Right.
what you
Yeah.
mentioned is they're not going to say, oh, my doctor cared about me so much. They wanted to run through things. They're going to be like, that dang doctor doesn't know what the heck they're doing. And now I'm
Now
got
I got to
stuck
make
with a
another
$2,000
appointment with
bill.
another person. Yeah. Yeah.
That's another consideration. So again, if you're dealing with a high deductible healthcare plan, it's not the $20 copay of yesteryear. You're now
Yeah.
paying $150 to see a doctor for 7.5 minutes who's been double booked. That's the reality. So add $150 to this whole mix of consideration.
Hmm.
Um, and hopefully through this presentation, it's starting to become really clear. Man, I just need to know a couple pieces of nomenclature: deductible, high deductible healthcare plans, a premium, co-insurance, copay,
Yep.
those types of things. And now I got the confidence to have great conversations with patients.
Hmm.
Because I think probably the first patient you're probably going to stumble a little bit on, but the second patient and beyond, they'll probably be pretty easy conversations to have.
Hmm. Love it.
Next argument, and this is the seventh of eight, is just simply not every patient is coming to you, a provider in integrative functional medicine, because they don't feel or they feel like they have a disease or they're looking for a diagnosis. A lot of times they just don't feel like they felt 2 years ago. And they just want to feel like they felt 2 years ago. So in this case, most of the testing, and again, for the most part, these conversations are just about the blood work and not any specialty testing. But sometimes we're just looking for optimization. We're not looking for a diagnosis, right? And so, and as we mentioned earlier, for the most part, this conversation is just hovering around the conventional blood work and not any of the specialty testing, the salivary, the stool, the DNA, so on and so forth. And then last but not least, so this is the eighth out of 8 bullet points, is keeping the message clean. When the message is murky, it creates a lot of heartburn, especially if you have the front of the house communicate with patients. So I know this because I bought 40 medical practices. The doctor will be talking to the patient in the back, and they're going to say, we're going to do this blood work through insurance, and then we're going to do these specialty labs through cash. Well, the patient's going to go up to the front desk and check out. And she said, well, can we just try to get this covered by insurance? I got really great insurance. Or fast forward 6 months and the patient comes back and says, yeah, the doctor got these labs covered by insurance. Can we try and see if we can get the IVs covered by insurance? I got really great insurance. It just really creates a murky message. It creates a lot of heartburn with your team. Trust me, I've seen it in play and excuse me, in practice. And I think it's just great. If you're a cash practice, everything should be running through cash, um, in my opinion. And so, kind of in summary, number one, what's the likelihood of your patients consistently getting to that 6, 8, north of $10,000 deductible? If they're pursuing integrative functional medicine, I would argue probably limited. Number two, pricing. Pricing varies pretty dramatically, and that becomes very important when we talk about balanced billing. Number three, patients can always use their HSA and FSA accounts, not only for the blood work, but they can also use it for that specialty testing as well. If patients just want the insurance to kick in any little bit and they want to self-file, you can certainly encourage them to self-file. But remember, if you're contracted with that insurance company, I would probably refrain from encouraging them to do that. Next, privacy. Privacy is certainly important for a lot of patients, and I think a lot of people would agree. Post-COVID, privacy has become paramount for some patients. balance billing, and this is the thing that we're all nervous about, receiving that bill 6-12 months later for maybe a test that wasn't a part of the negotiated plan or agreement, or a amount that wasn't or was above and beyond the negotiated rate. Optimization. Not everyone is looking for diagnosis when they come to see you. And last but not least, keeping a clean message is certainly ideal. So if you do want some additional support with Evexia Diagnostics, you can certainly scan this QR code. It'll send you to a calendar link. You can schedule some time with someone on our account management team, and they will be there to answer any and all questions that you might have.
All right, I do have a couple questions for you as we close it out, if you've got a couple of minutes for me, Ryan.
Sure.
So if you could tell me just a little bit about Evexia Diagnostics' internal physician network and how that can be utilized.
It's going to be utilized in two ways. Number one is if you're a healthcare professional, again, in this cash-based model, and your scope of practice does not include lab orders, we can utilize our internal physician network to sign off on those lab orders. So that's bullet
Oh,
point number
okay.
one.
Great.
Yep. Think health coaches, RDs, RNs, anybody, clinical nutritionists, anyone who has a healthcare or has a medical practice, but maybe their license doesn't include lab testing, they can order from
Okay.
us.
I love that.
Number two is if you are someone potentially who does have a scope of practice that includes lab testing, but you have a telemed practice and maybe you're seeing patients outside of your state, this is a great way to add an additional legal layer of protection to that lab order. Again, our physicians will sign off on that lab requisition, and for $5, it's a great way to protect your license.
Very smart. I love that. I'm excited to share that with our clients. I did not realize that. All right, couple other just quick questions. Any resources that Evexia offers to our audience? I know you had mentioned like a cheat sheet that you're going to send me that really can help maximize the ROI on their lab services.
Yep, that's exactly right. So I'm going to send you an email, and that email is going to have some assets from medical marketing Whiz to your clients, to the audience members. So again, they can refresh on this presentation, the bullet points, both in video format and as hard copy. And then we have some tools for you, the audience members, to utilize with your patients, again, in both video and hard copy format.
Okay, fabulous.
And
So I will
I'll
put
get
those
those
in
out to you right away.
yeah, I'll put those in the meeting notes under our video. So if you watch later, you'll be able to check that out. Any final thoughts that you would like to share? Maybe a couple of things that people can do kind of leaving watching this and that they can start to implement as soon as, tomorrow, the next day within their practices.
Yeah, I'm a big fan of this. I think scheduling 1 or 2 days a month to get off site. And it's the idea of working on the business as opposed to simply working in the business. Again, I bought 40 medical practices in a very short period of time, and I found really quickly that the business owner or previous business owner, they got so focused on the day-to-day or
Yep.
maybe the week-to-week, they forgot to work on the business. So here's my bit of advice is I would schedule 1 or 2 days a month. And it can't be on weekends. It can't be family time. It needs to be Monday through Friday if those are your clinic hours, and go off site wherever you need to do, or whatever you need to do to get into flow state, meaning the ideas just come to you and you can't even keep up writing them all down. That's where you want to get to. And again, I would say know thyself. For me, I can get in a flow state pretty easily if I'm in a very noisy Starbucks. That white noise helps me dial in. And then the second area, which is on the complete opposite end of the continuum, is if I go for a hike, I can also get in a flow state. But what I recognized is I have to be hiking by myself. If I'm hiking in a group, I can't get there. So again, I would highly encourage you schedule 1 or 2 days each month to work on the business as opposed to in the business, and then know thyself. Where do I need to get to? What do I need to do to get into flow state and maximize those hours?
Yeah. And I would say that even as myself, I've had to learn that because otherwise I can get my ideas in the shower and then it's right straight to work. So you have to give yourself the space to come up with those ideas and again, dive into topics like this where you can uncover opportunities for cost savings for your patients and for your office. So I think that's huge. This was so valuable, Ryan, and I know you're such a busy guy. You've already done this presentation a couple of times. You're in high demand. I really appreciate you taking the time to meet with us and our audience and our clients. How do people get in touch with you or Evexia? What's the best way for them to get in touch with you?
You can certainly go to evexiadiagnostics.com. If you don't have an account, you click in the upper right corner. It's called sign up. Sign up for account. Having an account is absolutely free to you. That's a great way to get on the platform and start exploring it. You can always email info@evexiadiagnostics.com if you do have an account and you have specific questions. And then obviously we'll always be in contact through Medical Marketing Whiz on anything that we might be able to partner up on.
Awesome. Thank you so much, Ryan. This is great. I can't wait to get the replay out to everybody.
My pleasure.
All right. Have a great one.
Bye-bye.